Chemotherapy is often the primary treatment option for mediastinal mesothelioma instead of surgery due to the location and invasive nature of the cancer. Cisplatin or carboplatin combined with pemetrexed, Alimta, is currently considered the standard first-line chemotherapy regimen for unresectable malignant pleural mesothelioma. This combo is usually administered intravenously once every 3 weeks for up to 6 cycles. Pemetrexed targets folate pathways important for cell growth and replication, while platinum agents cause DNA damage. For patients with good performance status, this chemo regimen has been shown to produce an overall response rate of around 40% with a median overall survival of around 12 months. Second-line options after disease progression on platinum pemetrexed may include docetaxel, gemcitabine, raltetrix or vinorelbine. Maintenance pemetrexed after initial therapy is also an option to help prolong the duration of response to treatment. However, chemotherapy alone is not considered curative for mesothelioma, as the cancer often develops resistance over time. Radiation therapy may play a role in the management of mediastinal mesothelioma, particularly for palliation of symptoms caused by local tumor progression. External beam radiation therapy, EBRT, delivers high-energy X-ray beams to precisely targeted areas from outside the body and can potentially help control cancer growth and reduce pain, cough or difficulty breathing. For early-stage, potentially resectable mediastinal mesothelioma in which surgery is still under consideration, radiation therapy may be administered before or after tumor removal, also known as neoadjuvant or adjuvant radiation respectively. In these settings, radiation therapy aims to destroy any remaining cancer cells left behind after surgery or shrink the tumor further to facilitate complete resection. In advanced unresectable mesothelioma, EBRT can be used to treat symptoms at trouble spots if the disease is isolated to one region. Typical dosing regimens involve daily fractions of 1.8 to 2 grays over 5 to 6 weeks for a total dose of 30 to 54 grays. Treatment is generally well tolerated, although side effects can include fatigue and skin irritation at the treatment site. Intensity-modulated radiation therapy, IMRT, or stereotactic body radiation therapy, SBRT, may help improve targeting accuracy and spare surrounding normal tissues from exposure and damage. Another radiation modality is proton beam therapy, which uses protons instead of X-rays. Compared to traditional photon radiation, proton therapy deposits most of its dose within the tumor while minimizing exit dose through healthy tissues on the other side. This allows for potentially higher doses to be safely delivered to the tumor. Proton therapy is not widely available though due to the high costs associated with building and maintaining particle therapy facilities. Photodynamic therapy, PDT, is an investigational approach for selected mesothelioma patients that utilizes the combination of a light-activated drug, photosensitizing agent, and subsequent laser light exposure. The photosensitizing drugs such as porphyrisodium, photofrin, or 10-ethyletiopurpurin, SNIT2, is intravenously administered where it preferentially accumulates in malignant tissues. After a period of drug accumulation, the tumor area is illuminated with laser light of a specific wavelength that is absorbed by the drug in the cancer cells. This triggers the production of reactive oxygen species which cause localized tissue damage and tumor cell death through mechanisms like vascular collapse. PDT has shown good response rates in a pilot study of MPM but mostly in palliation of symptoms like pain, rather than definitive treatment. It is generally well tolerated and does not cause cumulative toxicity, but penetration of light to deeper tissue layers remains a limitation. Additional research is still needed regarding the full potential of PDT for mesothelioma. Targeted therapy is an area of active research for improving mediastinal mesothelioma treatment beyond chemotherapy. These targeted drugs interfere with specific molecules involved in tumor growth and survival pathways. They demonstrate more selective mechanisms of action compared to traditional cytotoxic chemotherapy. One specific targeted agent being investigated is bevacizumab, an anti-VEGF antibody that blocks new blood vessel formation assisting tumors. Preclinical studies suggest blocking angiogenesis could help reduce mesothelioma growth and spread. Early-phase clinical trials of bevacizumab alone or combined with chemotherapy have produced response rates of 30 to 40% with durable stabilization of disease. Larger phase 3 studies are still required to confirm any definite survival benefits compared to chemotherapy alone. Other possible future targets being explored include EGFR inhibitors like erlotinib, which may work best in patients whose tumors have an activated EGFR pathway, as well as anti-FGF, HGF/MET and PD-1/PDL1 immunotherapies. Ongoing translational research correlating specific molecular markers on mesothelioma tumors with responses to different targeted drugs should continue to improve patient selection and tailor treatment decisions. However, single-agent targeted therapy has yet to fully replace chemotherapy in standards of care. Combination strategies with chemotherapy and radiation may be necessary to achieve maximum effects against this aggressive disease. Surgical resection remains highly challenging for mediastinal mesothelioma due to the location and involvement of vital nearby structures. As an alternative, comprehensive non-surgical treatments including chemotherapy, radiation therapy, investigational approaches like PDT and targeted therapy are being developed and refined in an effort to improve disease control and extend survival. A multidisciplinary treatment plan considering all these options is individualized based on the tumor extent, patient health and preference whenever possible. Significant ongoing research continues towards achieving long-term cures through combined modality therapies or advances in systemic treatment approaches.